Hello everybody. So today we will be discussing on one of the most important topics in spine surgery, that is tuberculosis of the spine. We all know that tuberculosis is an endemic disease in our country, and it is mandatory for us to know about the in and out about tuberculosis of spine surgery, as we are the one of the authorities in the world for treating tuberculosis of spine. So the evidence of TB was actually found in a 9,000-year-old Neolithic human remains in Israel and Germany. And it has also been mentioned in Rig Veda, and Hippocrates has also described about TB and its treatment in his manual. However, it was Percival Pott who described it as the palsy of lower limbs which accompanies curvature of the spine. That is why it is commonly called as Pott spine, which means tuberculosis of the spine with paralysis of the lower limbs. The most common form of osteoarticular tuberculosis is spinal tuberculosis, and it accounts for about 50% of all the osteoarticular tuberculosis. 64% of these cases are reported from developing countries like India, China, Nigeria, Pakistan, Indonesia and South Africa as per reports from 2020. The onset, however, it is very slow and the progress is insidious. Paraplegia is one of the most dreaded complications, and it occurs in about 10% to 30% of such patients affected by the tuberculosis bacilli. Now, before going into the tuberculosis and its pathology, we should know about Mycobacterium tuberculosis, which is the causative organism for TB. It is an obligate aerobe, acid-fast, as we all know, AFB, that is the most commonly used terminology for TB bacilli. And it is a non-motile, non-sporing, rod-shaped bacilli, as you can see, which is depicted in the picture here. It is very slow growing, and it requires about 2 to 6 weeks for growth in culture media, and this is one of the greatest challenge in diagnosing tuberculosis. However, we have come up with various newer methodologies and technologies to diagnose tuberculosis, but the gold standard is culture. However, it takes about a month to 1.5 months for its growth in culture media. The most important aspect of TB bacilli is it does not produce biofilm around implants. This is one of the most interesting and a friendly point for the surgeons. Unlike other bacilli or other pyogenic bacilli, it does not produce glycocalyx or biofilm around the implants. That is why when we are dealing with tuberculosis of spine or tuberculosis of any joints, even when we instrument, they don't produce this biofilm around the implants, and that is why it is easier to treat them by stabilization. And it may be present in a dormant state for reactivation later. Most of us in India, we will be harboring TB bacilli in our body. But when the immune system goes down in an individual, it is that time when this bacilli from a dormant state becomes very active. Coming to the pathogenesis, it is almost always secondary to an extraspinal source. Primary spinal tuberculosis by direct inoculation or direct bacteria affecting the spine directly is very rare. The most commonest method of transmission is hematogenous transmission. Suppose a patient may have pulmonary tuberculosis and it can spread by hematogenous methods into the spine. That is called as hematogenous transmission. It reaches the dense vascular cancellous bone, and it is because of the common blood supply to the paradiscal region. We will be discussing about that in the next few slides. That is the most commonest region for spinal tuberculosis. And since the cancellous bone, it is made up of dense vascularity, it is very easy for those bacilli to harbor there and to multiply. Strenuous activities, coughing can spread the TB bacilli via the valvulus Batsen's plexus from thorax and abdomen to the spine. So this is another method of spreading. So the commonest spread is by hematogenous transmission. The next spread is through valvulus Batsen's plexus. These are the various types of tuberculosis when it has affected the spine. As I said, the most common type is paradiscal. As the name suggests, it is on either side of the disc. That is why it is called as paradiscal. It is because of the common blood supply to the lower half of the superior vertebra and superior half of the lower vertebra as a part of the embryologic development. That is why when the bacilli comes here, it involves the corresponding or adjacent areas of the disc of the vertebra above and the vertebra below, and it is the most commonest type of tuberculosis in the spine. Next is the central type of tuberculosis, where the TB affects only the central part of the bone, and it can eat away the bone and it can result something called as vertebra plana, which could be seen in other conditions. But if there is central tuberculosis, it can cause complete collapse of the vertebra, and that is why it is called as concentric collapse or vertebra plana. Another rare type is anterior form of tuberculosis. When there is spread of this TB from the anterior structures, it can erode the anterior aspect of the vertebra. This is called as the anterior type of tuberculosis, and they usually present with scalloping of the vertebral borders. Because of the abscess, it can present with scalloping of the vertebral borders, as you can see in this image. A very rare type is called as the posterior type or the appendiceal type, where it involves the posterior elements of the spine. It is quite rare. Initially, before the advent of MRI, it was called as spinal tumor syndrome, because people used to think that it is some kind of tumor in the spine or spinal cord, because it affects the posterior elements and the spinal cord. But however, after CT scan and MRI, it is very clear that it affects the posterior bony elements like lamina or the pedicle or transverse process or spinous process. So these are the broad 4 types of tuberculosis of the spine. Now this is an example of a central type of tuberculosis resulting in complete vertebra plana. As you can see, the vertebra should be like this, a normal square, but here the entire vertebra is gone like this. The disc above and disc below are almost intact, and the entire vertebra is completely gone, and you can see some amount of abscess which is present here. So this is the abscess, epidural abscess, because of the sequestrum and granulation tissue and collapse of the vertebra. And this is a classical example of paradiscal. So you can see the spine getting involved on either side of the disc. That is why it is called as the paradiscal type of tuberculosis. Basically, what does tuberculous bacilli do? It affects the trabecular bone. So that is why it is called as tubercular spondylitis. Usually we do not term it as discitis, because it is not going to affect the disc. It is going to affect the bone marrow. That is why it is called as spondylitis, inflammation of the vertebral bone marrow. So it goes and affects that. It eats away all the cancellous bone, and as a process of destroying or destruction of the bone, it will result in the formation of abscess, pus, sequestration, granulation tissue. As we all know, TB results in something called as caseating necrosis, which is the most pathognomonic feature of tuberculosis. So it results in a caseous material because of the necrosis, because of formation of Langerhans giant cells, epithelioid cells, and that will destroy the bone, will result in the formation of pus, abscess or granulation tissue.